All right, we're going to go ahead and get started. Thank you, everyone, for attending our brown bag session, our first for November. It's hard to believe November is here, and pretty soon we'll be ready for the holidays. So today, what I'll do is I'll just do a short, quick presentation, just kicking it off, and then we'll hand it off to our guest speaker here. So what I'll do first is I'll just kind of go over our presentation today and just do a couple quick housekeeping items. Sorry about that. A couple things today. So today we're having a guest speaker, Dr. Ragan Schriver, on implementing trauma-informed pedagogy in an asynchronous course. Just so you're aware, we do have a team of online instructional designers here and media developers. We're not going to introduce ourselves today just for the sake of time, but we are here. Some of us will be here in today's meeting. If you do have any questions, feel free go to the online learning at utk.edu and let us know. A couple of announcements. Our next OLCOP is going to be on November 14th at noon Eastern time, and I believe they'll send a link in the chat room for that registration. We also have virtual office hours throughout this semester, several times during the week if you want to just pop in and ask a question or just wanted to bounce off ideas, and we'll provide that link in the chat room as well to our office hours. We also are looking for faculty for our spring 2024 brown bags. These opportunities are for you to share your online teaching experience and any new innovations that can help the University of Tennessee community. You definitely don't have to be an expert. We understand some of you might be new or have done it a couple times. That's okay. We're just looking to share ideas and get some new innovations out there for online learning. All right, so what I'd like to do next is just introduce our guest speaker today on implementing trauma-informed pedagogy in an asynchronous course. Dr. Ragan Schriver is an associate professor of practice and director of the Master of Science in Social Work program within the College of Social Work. He has been with the University of Tennessee as a part-time instructor for 9 years, and now he's in his 10th year as full-time faculty. He has taught at all levels, undergraduate, master's, and doctorate using online pedagogy. He teaches courses in graduate trauma treatment certificate program, as well as the core curriculum. He has over 20 years of experience in social work practice, including clinical work and leadership as the executive director of a multi-service large social agency. So what we'll do next is I will go ahead and stop sharing, and then we'll have Dr. Ragan Schriver introduce and get started.
Thank you. That was a great introduction. It made me sound like I know what I'm doing. So at least I can fake it through this. I'm thankful to be here. My name is Ragan Schriver, and I see a couple of my colleagues from social work on with us today, and I'm excited about that. And I'm excited to share some of my ideas about trauma-informed care. So we've had the Master of Social Work program has had an online program now for about 11 years. And so we've been really trying to innovate on, trying to make this the best, that we can. And especially since we're teaching students, our master's students, how to treat persons who have experienced trauma, that we want to have something that's, that we want to try to be able to, do so and to teach in a trauma-informed way. So we've had some pretty cool little trainings about it. And so I just want to kind of share my screen here with you. And then, so I feel like that I'm sad that this is going to be since we have just a quick hour, that this is going to be more of a do as I say, not as I do kind of thing, because I'm just going to maybe tell you stuff. Because really, if we were doing a trauma-informed pedagogy at, in an online sort of environment, I feel like that we would have spent more time like maybe hearing a little bit more about what are people about, what are they doing. And if it's an asynchronous approach, you can do things through the discussion posts on Canvas that really are cool, to where you can just kind of tell about yourself and tell information that you'd like to know and give a chance for people to feel that they know each other. I think one of the big hallmarks is we'll kind of talk a little bit about some of the things in trauma-informed or trauma-responsive sort of approaches to caring and working with people, are that if people feel like that they belong and that they feel that they know the other people in the group. So I think that would be really important, especially like if you're in like psychology or social work or something like that, where you're sort of sharing some of the things that are a little bit more interpersonal or maybe more emotional about yourself, that you're sharing it with others, or kind of giving some insights about family or whatever, or your opinions on maybe even political issues, that you feel like you're in a safe environment. Safety is a big deal. So I think if we could keep safety and belonging as the two number one number one and two things that we're thinking about as we go through the whole idea of becoming trauma-informed care, trauma-informed pedagogy, and to think just whatever I'm doing, and creating my Canvas site and creating readings, creating assignments, that if I'm doing those two things, will this create a sense of safety for the person, and will the person feel like a sense of belonging in the class as they go? And so that's basically what I'm saying here with my little cartoon of you rock and you rule, to think about, like, are there ways that we can sort of build on the strengths of everyone that's involved? So I know, like, that there's some classes, I guess, that are done asynchronously where there's tons and tons of people in it. So it's hard where you're going to get to know everybody, or you feel like everybody know everybody by name. But if there is smaller classes, it is helpful to have some formal use of your name and things like that, and to kind of help maybe people recognize their strengths, the strengths that they have. What are they bringing into it? I think sometimes, students will come in and feel maybe I hate to overuse the word trauma, but maybe a small t, traumatized by math or traumatized by chemistry or something like that. And they feel, shaken by that. And I think just to recognize, hey, maybe you might be really good at soccer, or you might be really good. Maybe think about something that you're really good at. Think about that. Okay, well, what made you good at that? Well, I practiced, I enjoyed it. I talked to people, I got coaching. Well, it's the same thing with whatever this is, whatever chemistry or engineering, whatever class it is, to think about something that you're good at, and then try to apply some of those same things that you got to be good at that thing, that maybe you could apply some of those same concepts to this. And that's like building on the strengths of ourselves. And I know that, like, it's hard to be reminded of all those types of things, but I think that's another really important thing. But also just to say that here today, I'm just giving some of my ideas and some things that I've just building on pedagogy stuff from things I've researched and read about trauma responsive care. And so if anybody has anything interesting that they'd like to share or interrupt me, feel free, please feel free. But also to say that, to acknowledge that some of the things I'm going to describe what trauma is and a little bit about how it hits the brain. And so sometimes that can be hard to hear because it might remind us of something that we might have been through that was difficult for us. So if you need to kind of step away, or, turn the camera off, or whatever, please do that. Please care for yourself. Or, if you'd like to reach out to me sometime, maybe we can connect on some of this stuff. So just please do whatever you can to take care of yourself. And I feel like that's another important thing to say to our students that are saying, like, hey, how can we help you take care of yourself in this process? Because you're not going to soak up this information if your brain's, going through other things, or you're having an emotional response to something. So please, reach out to me as the instructor, reach out to the TA if there's something difficult that you're having. And then I think that's important. Also, I think self-care is important, as I'm going to wrap it up here for at the end of our little time together, to say that really self-care of you is a big deal. I know, like, if I've had a stressed out day and I've been running from thing to thing, and then I start grading, or I start responding to students an email that are in an asynchronous learning environment, and I'm firing stuff off real quickly or whatever, I might not be as thoughtful, or might not be as careful. So I really do need to kind of like think about, how am I taking care of myself as the instructor? And that's a big deal. And it's also a big ingredient in trauma responsive care in any sort of area that you're looking at, is that how do I care for myself so that I can give the best of myself to the students that are signed up for this. That's a great big deal. So, okay, if I asked you guys, maybe if you had a pencil and you saw these 9 dots on a piece of paper, and and I asked you to draw 4 straight lines and connect all 9 dots, do you think you could do it? Well, since we just have a brief time, I'll give you the answer. So the answer is that you have to step outside the box. You have to step outside the box. And I think that's a little bit about what trauma responsive care is. It's about kind of stepping outside the box. I feel like I feel like we all learned, to give good lectures, to get your notes out there, make a good PowerPoint, those kinds of things. But I think being aware of where a person is coming from in their experience, if they've struggled or if they've been hurt or there's been some difficulty in their life, then how do we go outside that typical box so that I can try to reach them and touch them in some way so that they can get the information that we're called to do. So here's just a little quick, just kind of case study to think about. Okay, so Jason is a first-time college student, first generation college student, and he's coming in as a freshman, and he's taking a math class. So he logs into the Canvas site, and it's an asynchronous course. And he sees on the Canvas site or the learning management system, he sees that it's really busy, and he's not real clear on exactly where to go or what to do. The directions aren't real clear on what button to push or what the message is. And there's not a clear message opening on the front page saying who the teacher is. There's not a picture of the teacher. So he begins to feel a little bit uneasy, a little bit disconnected from it. He's never done this before. So he starts getting a little bit nervous about it. Then as the semester kind of goes on, the dates start changing on due dates. So there's a due date that's changed, and so but no one's alerted of it until too late, and so they get the message about that being a message. Then there's also there's a discussion board about one of the elements of math. They're discussing math, I guess. And so when the discussion board stuff starts coming out, it's not very monitored very well. The students are just saying their stuff back and forth, and the teacher doesn't seem to interject at all. In fact, sometimes it goes off the rail and kind of says things that aren't helpful or a little bit hurtful. So things get real negative a little bit there, and then the student begins to feel even more nervous about it. If we were to know the little bit of the background story of Jason, is that he was bullied in high school and felt had a difficult time in high school, kind of connecting, and so then he kind of shut down and didn't do as well in school as he thought he could have. So he feels like some of those same things are coming up here again with these words in print that are on the discussion board. The teacher's not intervening and helping. He's confused by where things are. And then he's not getting feedback in a timely manner. So that's amping up. He's getting nervous about the not getting feedback. So as you can see, this isn't a very successful approach for him. He ends up dropping the class and then dropping out of school because he needs that math credit. So let's think about Jason as we kind of talk through some of the concepts here. Okay, so the bottom line when we think about trauma responsive or trauma informed care, this part of this new stepping out of the box is to a paradigm shift of trauma responsive care. And that's rather than asking what's wrong with you, to ask what happened to you. So if we thought about Jason, the teacher might be saying, gosh, what's wrong with that Jason? He's never turned his things in at the right time, and he doesn't really comment much on the discussion board. What's wrong with him? Well, really, the question really is more shift of what happened to you. So did Jason have a negative experience in education as a younger person? Did he have a tough time in school? Maybe he's having a hard time. He's never worked this kind of computer before. Maybe he's never worked in a learning management system like this before. Maybe he had bad experience with math. So the question is, what happened to you? I know sometimes when I get messages from students, sadly, my first question is, what's wrong with them? Why don't they get this? I know I'm really clear, and then I'll look at my message and it's not clear, or something like that. But I think just to think about, okay, well, what happened to them? And how can I not categorize that person as faulty, but how can I categorize what they've experienced as kind of a difficult thing and try to help them in the situation to meet them kind of where they are? Then the other kind of question is, shift from control to collaboration. Well, that makes a lot of sense when we think about intervening in kind of therapeutic interventions like we teach in social work, that sometimes we think, well, the social worker or the counselor or the psychologist is the one that's supposed to be in control, and that, you're the patient. Well, it's the same thing, I think, for us as teachers sometimes. Well, I'm the one, I have the knowledge, and I'm here to impart it on you, rather than looking at it as a collaborative effort. I know like math, you need to just kind of tell, well, 2 + 2 is clearly 4 or whatever, but you're kind of doing that. But then maybe you could talk about like get people to collaborate on this. I think like, again, this may be hard to do with hundreds of students, but if there's some way to kind of collaborate and help kind of maybe build some of the things together, think how cool it would be like if a student that was afraid and really nervous about what was going to be poured upon them to think, wow, maybe I can have some input. Like, when do you prefer, like, do you like the heaviest assignments due at the middle of the semester or later in the semester? Do you prefer me to do assignments incrementally, or do you want it all done at the end? Or maybe if there's some way to, I don't know, it's easier said than done, but if there's some way to get a little bit of collaboration on how do you want to approach this today. Sometimes I do that with, even in an asynchronous environment, like kind of put out on a discussion board. Hey, what's everyone feeling today? Or what kind of content are you missing? And even like at the beginning of the class semester, like what are things that you'd like to learn the most out of this class? And then if the student sees those things responded to, then they feel like they've had some kind of collaboration. I think that creates a bit of safety and also a bit of belonging, that, your voice matters. Wow, I've never been in college before, but wow, my teacher's really asking my opinion and wants to help me figure out what I can give to this situation. That's a really helpful thing. So those are the two kind of big paradigm shifts. Now, here are a couple different perspectives on trauma that have been put out there. To be honest, it's sad to me that the American Psychological Association doesn't have a great definition of what trauma is, and I don't think Webster does either. So I'll kind of give a little bit of what my own definition of trauma is. So I think trauma really is analogous to like a city that has a water removal system. There's a system that's in place that when it rains or when there's water, that the sewer system or the water removal system, takes the water out to the river. So like here in Knoxville, when it rains a normal amount and the water is removed and everything's taken away out to the Tennessee River or whatever. Well, it's the same thing for us as human beings. We have a system that deals with stress and anxiety and difficult things in our life. So we have this system that we kind of deal with things. So typically, if something comes in a negative manner, maybe some violent happens, or maybe there's some difficulty that I'm exposed to, then my nervous system, or the system that I have, will deal with it or help me get to a safe place by fighting or fleeing or freezing, whatever the most safe thing that I need to do is. And then it will resolve and go back to kind of what I was doing before. Well, that's just like this water removal system thing. When a normal rain comes, it's removed. But then sadly, sometimes there's real big bad flooding, or there's some big bad rainstorms, and then the water removal system becomes completely overwhelmed. Things get backed up. There's damage to the roads, there's damage to the yards and the everything, and so then people can't get where they're supposed to do, and there's a lot of difficulty with it. So the same thing is true for us in trauma. That if something negative happens, really difficult, really kind of significant, and whatever it is, that our system becomes overwhelmed. And then the system is evolved to a way that it's always responding to that negativity in some way. So it's really the thing about trauma is that we could say, well, it's these 3 or 5 or 10 things, but really those 3 or 5 or 10 things are going to impact each person a little bit differently. So we talk about trauma being the experience of it, not the exposure. So a student may say to us, wow, this X happened to me when I was in school or when I was a young person. And then I may be thinking, gosh, that's not that big of a deal, or that was a long time ago, or whatever. Because my nervous system might have been able to handle that in a different way. But maybe that person, the younger person that you're speaking to, the students, didn't handle it that way, if that makes sense. So really the deal is, we don't say like trauma is X and X. We say it's the experience of the person. So we know that it can have chronic impacts on the person. So a lot of the people that do come to us may have some sort of an experience or a background in some sort of negative adversity that's happened to them, and it's impacted their nervous system into a way that now it's hard for them to engage in a class setting or whatever. But really, all that is a natural response. In fact, I think, to me, kind of to say that evolutionarily, when we flash back to our ancestors that lived in caves or lived in whatever they lived in, if they saw the sound or saw a tiger coming towards them, they knew that that meant danger. So the tiger equaled danger, and their life was in harm. So they would the body then would prepare itself, like, get ready. We got to get out of here. I got to go hide, or I got to freeze and hide, or I've got to be able to fight it back, or whatever I need to do. So that is a protective thing. The anxiety that we have about school, even a little bit, is a little bit like the anxiety that we might have for a tiger. It kind of gets us amped up so that we perform our best, so that we're focused and we need to do what we're going to do. So a little bit of anxiety around a schoolwork can be pretty good. But the bummer is that when there's so much overwhelming stress, if there's a lot of stress going on, if it's chronic things going on, then it's the tiger lives in our home, and we're constantly feeling that element of stress or anxiety or agitation because we can't calm down because maybe a traumatic experience that we've had in our lives. I think, like, when we think about folks that are doing a lot of the pedagogy, taking in their learning in an online environment, at home, if home is difficult or home is where the trauma was, that can be really tough. I had a client one time that talked about how, in a therapy setting, where the client said that that they used to get really, really anxious on snow days because that meant they wouldn't go to school. All the other kids were psyched, no school, yeah. But it made him anxious because he was living with his uncle who was abusing him. And so he knew that if he stayed home, that brought about anxiety. So sometimes people that are learning at home, they might be in an environment that's really stressful. So that can be a thing to kind of reflect on or think on, and maybe encouraging our students to go to the safest place that they can when they're learning, or maybe if they have to concentrate some, to be able to think about how can they find a safe place to do so. So we know through this particular study that was done in the late 90s called the ACEs study, the Adverse Childhood Experiences Study, how trauma impacts us throughout our whole life. So you can see on this little triangle thing that's there, or that little pyramid, you can see that if there's some sort of adversity, if there is a childhood trauma or some sort of traumatic experience, that you can kind of see as it grows and as it develops through your life, that the impact can continue to grow and expand. Like, it just doesn't go away. In fact, it can get, like I said, get worse or impact you in different ways, leading to an early death. So this whole issue of trauma really is kind of a public health concern rather than just, it's an individual problem or something like that. It's a public health issue because I think people responding to their trauma can in negative or adverse ways can lead to an early death. So we know that from this study, 64% of the population has had some significant trauma in their life. And these are some of the things that we do to respond to trauma. We end up maybe eating too much or smoking to try to make to calm our nervous system down, or we maybe take medicine, or maybe or we start feeling depressed, or start engaging in sexual activity that might not be that helpful or healthy. So that ends up to just try to help numb the feelings of things. All of this stuff is just so distracting from the schoolwork that we're having to do. So that's just really something to kind of think about. And to think about, well, when our students are having difficulty outside of the classroom setting or outside of this learning environment that we're doing, even if it's asynchronous, that maybe it's as the result of some traumatic experience that needs to be looked at. Sometimes we talk about big T and little t. So, I don't really like that big T, little t, because it sort of puts a label. Is my trauma just a little t? But we do kind of think about that. Sometimes the literature talks about that, like a big T trauma being something that's very significant, like an assault or abuse or something like that. And then the little t trauma having to be like maybe a breakup with a spouse or a significant other person in your life, things like that. Some people are dealing with chronic trauma throughout their whole life, where there's been some sort of an abusive situation where they've been living with for a long time. That's really impactful and terrible on the nervous system. Complex trauma can be what we call like trauma of attachment, as well as trauma like that something else is coming into their life as well. It's sort of a mixture of different perspectives. So those are things to think about. So bottom line, though, trauma is the experience rather than the exposure. That's what I was just trying to say a few minutes ago. So if we were to look at the human brain and see how does like a traumatic experience sort of deal with things. Okay, so if we were to look at, I hope none of you are brain scientists that are in this class, teachers in this class, but so if you look at that green part of the brain there, that's that behind that, underneath that is a thing, the limbic system. So in there, that's kind of like your alarm system of your brain that sort of like is the emotional stuff. So what happens there, it's real close to that yellow section there of the brain, that yellow and brown section, which sort of like the yellow and brown are doing like your heartbeat, keeping you breathing, kind of automatic things that you would normally do, kind of to keep yourself alive, that you just don't even have to think about it. It's just automatic. So the emotional part of the brain does interplay a little bit with those sort of automatic things. If you think about it, you get excited or whatever, maybe you might breathe a little bit heavier, or if you're getting nervous about something, your heart will beat a little bit faster, or maybe you'll shake a little bit or something like that. That's a normal physiological response. So when we think about trauma, a lot of times that the trauma is sort of the memory of it, the impact of it, the emotional response of it is kind of held a little bit, for lack of a better word, in that area that's underneath the green section of the brain there. That would then impact the yellow and brown section. So maybe like if I'm having an emotional response to something, and then that's going to affect my breathing and my ability to sit still and my ability for my heart rate to remain calm. Imagine how hard it is to really kind of sit still in front of a computer and get things done. Then the same thing, if you look up at the other part of the brain, that red part of the brain up there in the front, that's where kind of like logic and your ability to think, your ability to verbalize things and talk about stuff, all that stuff is going on up there in that front part. Okay, but if you think about it, if I'm in a trauma response, if I'm in an emotional response, the green area is going to be communicating with the lower part of the brain. It's not going to engage the front part. Because if I'm thinking, okay, I'm in danger or there's something difficult and tough going on, I'm going to be more like thinking, how am I going to survive this? How am I going to get through this in a survival? I don't have time to stop and think, talk about it, plan about it, make a list about it. That's what the front part of the brain, I want to disengage that front part of the brain so that I can just do what I need to do to protect myself. So if you think about it, I feel like our whole a lot of times our whole asynchronous online teaching approach is to engage this front part of the brain, and so if somebody's unable to do that, then how can they really engage in the coursework or in the classwork? Well, what does that mean for me as a teacher to know that? I wonder if sometimes if I can do things like maybe to start off the module or to start off a lecture, maybe like with something that's safe or something that's comfortable or something that's calming, a picture on the module that's kind of calming or whatever, or maybe reflect about a moment when you feel calm or something to help the person sort of calm down if they do get nervous about the content that you're teaching, just so that there's a little bit of a sense of that. That might be to kind of reintegrate that front part of the brain so I can be a little bit more rational about what it is that I'm learning. So a lot of it goes down to just the little smallest things in our body, which are the neurons, the cells of the nervous system. That's a big part of the story. So if you think about the neurons in our body, they are use dependent. So we're born with very few neurons, the neurons that tell us to scream when we're hungry and to cry when we're tired, and that's basically what they're doing. That's it. But then as we grow, 1 month, 9 months, 2 years, we're growing a lot of new neurons and a lot of new neuronal connections are being made. So look at that at the year 2. Between year 2 and 3 in there, you're going to have a ton of new neuronal connections kind of being brought together, because that's all the new experiences that you're having and all the new things you're seeing and all that kind of stuff. Okay, then around 2, there's another process, not just growth, but another thing called pruning, where a lot of the neurons, then the ones that you're not using, sort of go dormant and they're pruned. So there's the regeneration and pruning that happens throughout your life. Well, the ones that are regenerated or ones that are reinforced are going to be the stronger ones. So there's not going to be a ton of neurons there, but the ones that are left are going to be stronger and thicker. You can kind of see that in that last slide there for the adult. You see there, the sort of like the slide shows darker sort of webbing. That darker webbing shows a darker connections. So that's how kind of habits and responses get developed. Well, if I'm brought up in a situation that's stressful, or if I've lived with a horrible traumatic experience in my life, the connections and the neurons that are going to get stronger and the ones that are being repeated the most are going to be the ones often that are maybe around stress response or avoidance or things like that. And then therefore, those are going to be strongest one. It's going to be hard to change the behavior. So people are going to come to you, and students are going to come to us. They come to us all the time, and they want to learn the new stuff, and they want to make it through the class semester and be successful and all that. But a lot of times they bring a lot of really bad old habits. And so we're not going to be able to change that probably in a 15-week semester, especially, kind of in an online setting. But to think about what influence could we have so that we were better able to really bridge that to help the person be able to fully engage in the work that we're doing in the classroom. So to kind of back it up a little bit more, this is basically bottom line of what I'm saying about this neurological stuff, is that there's toxic stress that occurs in a person. It's processed through the human brain. Chemicals such as cortisol are released into the system, and through all the different processes, and that cortisol can impact the person in a lot of different ways, kind of even reducing their immune response and things like that. So sometimes you might hear, maybe students saying, "Oh, I'm sick. I can't partake this week, or I can't help this week, or can't be a part of I didn't get my homework in because I'm sick." A lot of folks who are ended up maybe a little bit sick or have difficulty physically, it's because maybe their body is so worn down by all these extra chemicals running through their body that they're having a hard time carrying on through life. And then we know that this even can impact our genetic experience, and then that can be passed on to the next generation after us in a way. And that's a whole lot of studying, but that's just one way to think about it. So when we think about this genetic or epigenetic discussion, we're thinking about maybe parents and grandparents and grandchildren, that maybe some sort of traumatic experience or traumatic reaction is being passed on to generations below us. We know through a study that grandchildren of Holocaust survivors are more likely to experience anxiety and depression than other of the same age and controlled for other things. And that could be because maybe that there was some genetic alteration due to the horrible, stressful situations that people were in, and then that was passed on to the next generation. So think about maybe people that are coming to us in class. Maybe they've inherited like a lack of an ability to kind of deal with stress in a certain way. So that might be what they're dealing with when they come to class. Another thing that I think is important to think about biologically for persons with traumatic experience is to think about how memory is sort of processed in parts of the brain. There's a process of encoding and a process of consolidation. So that's a two-step. So the memory comes in, it's sort of coded, and then it's consolidated in different ways. So when we think about memory, this is basically memory coming in, and this is sort of like a little analogy with these little dots. It comes in all kinds of different ways, but then our brain sort of files it away or consolidates it in a way so that we can kind of make sense of it. Oh, this is a memory about my childhood. This is a memory about what I did. This is the memory about what I need to know for school. But when people are dealing with traumatic experiences, a lot of times that memory becomes a little bit tougher. So when there's that kind of cortisol and all the things that are flooding our body and our brain, then things don't get real encoded very well. And then it becomes very hard to tell a coherent story about what exactly happened. A lot of times, like when people are trying to recall a traumatic event, it might be remembered in little like photographic images rather than a movie that they could tell a story of. So therapy is what kind of helps bring about maybe more of a movie rather than just snapshots. There's different therapeutic interventions to help with that. But if you think that somebody's having trouble with memory around a traumatic experience, this may also impact their ability to have a memory in school too. So I think when we're asking people to kind of just memorize things, or can you memorize this list and respond back to me, but that becomes, maybe can be a little bit more difficult or tougher for people. I think if we can contextualize things as much as possible, rather than just, hey, memorize this list of 9 things, but how does this list of 9 things impact you? Or how does that become part of you? Or how does that become part of a situation that you're in? So if things are contextualized a little bit more, I know that takes a little bit more thinking and a little bit more grading if you're asking for essays rather than just multiple choice. Can you check these 3 things? But can you tell a story about it? How do these 9 things really play in your life or you want your future career to be? That can be an issue as well. So I'm not going to go on too much about symptoms of trauma, but I did want to say that something that's really, really, really important is to remember that oftentimes triggers, which are like that little part of the brain, the amygdala, that's kind of hanging on to things. It's sort of a sensory thing that's scanning the environment for danger. So the amygdala can alert and let the body know that that there's danger, and the body's going to respond through breathing quicker and rapid heart rate and skin conductivity and things like that. So then that's going to happen. That trigger is there. Now, say like if I had a smell of something when I was maybe being abused or hurt or bullied or something terrible was happening to me, and there was a smell in the air or to the person that was perpetrating upon me, then that smell is going to be something that's encoded in my brain. It might not be consolidated in a very clear manner, but it's going to be in there. So say I go out to school or I go to wherever I'm going and that smell hits me again, a similar smell, that's going to send my body into the fight or flight kind of approach, which is a trigger. We call that a trigger. So sometimes if what we're trying to do is create a trigger-free, environment for whatever it is that we're doing, can we keep our the Canvas sites as calming as possible, as soothing as possible? Can we keep our interactions with students as upfront and collaborative as possible to reduce the trigger response? Then flashbacks are a big deal as well. Sometimes triggers beget flashbacks, and then the flashbacks end up begetting trigger, which just makes it worse. It's sort of like a little cycle. So bottom line, what I'm saying here is this is us on a typical good day, that we can learn stuff, we can interpret it, we can process it, think it through. What are our options that we can do with this, make a plan, and then eventually act upon it. But we end up sometimes because of something traumatic or something negative may happen, that puts up a roadblock on the thinking things through part, on the processing, evaluating, and planning part. Then we jump from, oh, this is dangerous or this is difficult, I need to act. And that's survival, because I see a tiger, I need to act. I see something dangerous, I need to get out of here. So that's what's happening. So then the bummer is that a lot of us end up with the back road being the alarm system road, being our main highway, and we just observe and then act. And I think that sometimes can be a lot of our students. Maybe if something negative happens, if they get negative feedback, they immediately want to contact you. Or maybe like they immediately want to avoid you, or they immediately want to drop the class. So I think there's a lot of times an immediate reaction to something negative. I'm on the alarm system highway to doing something that's not going to be that helpful. So I think like whatever we can do to try to say like, hey, I'm here to talk about this. If you get a bad grade, let me know. Or if you let's talk about it. Or if you're feeling uneasy, let's talk about it. Or maybe build a little small groups within the class that if people are having a tough time, how can they connect one with the other? So then they kind of are forced to go down to that processing and evaluating thing rather than just acting. Experiencing and then acting. I don't know if that makes sense. So I think that's one. I'll skip that. So okay, so this is something that's really important. And the point of all this is to think about how can these core principles of trauma-informed care, TIC, how can these main principles be integrated into my work as a teacher, utilizing Canvas, or if I'm in an online setting, or if it's an asynchronous setting, however that would be. So number one is awareness. And so you guys are here today, so this is awareness. And I think that's awesome. That's the biggest part of it, is just being aware. Well, maybe that kid that's just coming in here isn't trying to be just a punk or something, or trying to be whatever. Maybe there was something negative that happened in their life. What happened to them, not what's wrong with them. I'm aware of it. I think that's a big deal. So I think that's the first one. Then the deal about safety. How do we create a sense of safety? That's what I started off with in the beginning. How do we create a sense of trustworthiness? So I feel like that trustworthiness isn't going to come when I say, oh, trust me, everything's going to be fine. Because I think a lot of people who have experienced trauma or traumatizing events have been told to just trust the perpetrator and everything will be okay. And so really trust, it can be very difficult for people. So maybe a way might be to engage with somebody and say, hey, I'd like to earn your trust. I'm not exactly sure how that would look for you. If you'd like to share that with me, that'd be great. But what does trust mean to you? But I hope I hope to earn your trust through this process. So I think that's a big deal. Then creating some kind of choice. I feel like this creates more work for us to do, but I've seen a little bit of success with this, a little bit in a couple of my classes, is that when, hey, students can either do this, or this activity. You could, like, I've had a thing where a student could interview somebody about something, or they could just write something, or they could, do some kind of experiential thing. So I think that's probably good learning, but it also helps give, from a trauma-informed perspective, it gives somebody autonomy. I think folks who have experienced trauma so much, things have been done to them, and that things have just been placed upon them, that there's been no choice. So I think whatever we can do to create choice in a person is great. You can work through this at your own pace. You could just have this done by X date. You can do it anytime, anywhere. Those kinds of things where there's a little bit of choice in things. And then I also kind of mentioned the idea of collaboration at the beginning of class, at the beginning of this little session, because I think that's such a big deal. How can I maximize the voice that the student has in the class? And I know it's not easy to do if you're not all kind of sitting in the same room. Hey, what does everybody think? But through discussion boards, through the wiki thing that you can do sometimes, or like building projects together or whatever, how do you provide some sort of collaboration processes? And then, of course, just empowerment, like just to remind the students, look what you're doing. You're soaking up some difficult concepts. Look what you're doing. Look what you've done so far. You've made it for the first 2 weeks, and look here, you're still here, or whatever kind of thing, that you might be able to say to students to encourage or to recognize and give them the empowerment. So to take some of those principles and apply them a little bit more specifically to some things for trauma-informed care, just in class setting, especially with asynchronous stuff, is to think about empower the students to self-regulate. So that's basically what I was saying a second ago about how could we create little reminders throughout the modules to say, hey, are you taking care of yourself? Have you eaten enough? How's your diet today? Have you drank enough water? Have you had any outdoor time today? Something like that. I think that those types of things, just little reminders of wellness along the way to empower them. I think that, that would be a really helpful thing. So here's a little bit, I think I have, a little bit more to talk of and specifically. But what I want to say is this: I looked all over for an image of like a badly organized LMS, but I couldn't find anything that was just like a good example. So I just put this, that really think about it. When we build the Canvas site, it really is the blocks that we're building, putting it on. It's our stuff. So, we get to kind of build it as we want. And I think that we could think about what would be sort of soothing, what would be organized, what would be, kind of a ways that people could easily find their way around. That's such a big deal. And I think making announcements where you're communicating regularly with the students, that type of thing. One of the things that they teach in trauma responsive care, like in a therapeutic manner, is that make sure that the building that you're going in isn't easily where you could get lost. So I think it's because, think about it, when you're lost, that just creates anxiety. I'm lost, I don't know where I am. And then do I have to stop and ask people? That sort of, it says, it might communicate, I don't know what I'm doing, or I'm not sharp, or whatever, kind of thing that we might be happening. But really to think about that same thing on the learning management system. If people are lost, that can bring about a little bit of panic. Like, putting an announcement out, hey, don't forget the assignment that's under the assignments, good luck with it. But like then go in and can't find where it is, that can bring panic or whatever. And then they could start emailing you or dropping out of class or whatever. But hey, if you send the announcement out, don't forget the assignment that's due on Tuesday at noon. It's under assignments. It's the third one down, just to kind of make it clear so that people don't get lost and don't get anxious about stuff. I think that's really important. I've learned that, I think, the hard way, because students like, where's this thing? I don't know, that kind of thing. So I think we've got an awareness. So we're encouraging self-regulation. So, too, you might even kind of encourage students like to have a fidget with them, or, sometimes we have those in class. Also encouraging and reminding students to get a quiet place in their home or their work spot, to where they're able to focus, or to just think about, do you like working in a place where maybe there's some background noise, and what can you access that? What's going to be the most helpful for you, so that you are empowered, the student is empowered to find out and to utilize the things that are out there that are going to be the most helpful for them. And then maybe to just remind people to take breaks. That's important too. There's this little video, I'll share the PowerPoint for sure, but there's this little video, this Dr. Spiegel, he talks about the human brain as kind of like this fist thing, where here's the spinal cord and here's the cerebral cortex, and then under here is that limbic system area that I was kind of talking about earlier, sort of the emotional response part. And he talks about, well, if you flip your lid, then that means that the emotional part is driving the bus of your life, rather than the kind of the thinking, rationalizing, verbal organizing part, where it's kind of like that. So the thing that he's encouraging is for people to be aware of that and kind of have that as a little thing. So, maybe that could be something that you could include like in one of your classes, or even kind of thing, they're like, to remember, even like put your hand into a little fist and remember, I'm going to keep my thinking part on. I'm not going to throw my lid off. I'm going to keep the cerebral cortex, or the lid on. I'm going to keep the lid on this so that I'm able to think and not let the emotional part of my life drive this bus. When I get anxious, I'm not going to start saying, all right, I'm going to act. The anxiety is the thing that's going to drive everything. I need to kind of put some thinking in here. Okay, I'm anxious because I didn't do well in the first test. What would I do? What kind of plan can I make for that? And kind of empowering the person. You could like have that as like a little reminder, which also reminds me of like the empowerment of like grounding techniques, where somebody like can feel their feet in their shoes, or feel their butt in the chair, or feel their hands on the table. That, like, I think that type of thing, maybe you could even do a little like, hey, what kind of chair are you sitting in? And that could be, you could ask that. I know that seems like maybe a funny thing to ask, but like drawing people in to recognize their body being in a place, that their body grounded somewhere. So I think sometimes when people get anxious out of a responsive trauma or something, then they can get a little bit, forget their body, get so much in their head or so much in the anxiety that they forget where they are in space. But to realize, hey, look, I'm here, I'm in front of the computer, I'm sitting at my table, I'm going to be okay. I can feel grounded in this, in the setting where I am. So I think that might be a good little reminder too. I think safety is, of course, a big deal, that to whatever we can do to create a sense of safety, that, it's going to be okay. This is the container that you're in for this semester, and these are the people that are in it. I think that requires monitoring the chat, the discussions that are going on, making sure that people, that know that they can reach out to you, that type of thing. And then to ensure opportunities for success. I know, like, sometimes that you could do a scaffolding thing and like, look, give a couple quizzes earlier in the semester on things that are sort of basic. And as topics get a little bit more complex, then you could do more complex activities. But if students could see, okay, I manage this one, I'm good, I know that one, that can create a sense of safety. Like, all right, I know what I'm doing in this class. I think I can keep on doing this. That's good. Let's see. Here's a couple things specifically about some safe learning environment. I think it's the clarity of expectations is a big deal. I know this is where rubrics come in really, really handy. I think that's an important thing. Hey, write a paper about, what you did last summer. I know that's dumb, but okay, well, how long is it? Do you want a title page? Do you want references? What do you want? Okay, let's be super clear so we don't have to create that moment of anxiety about what exactly is being expected from this assignment. I think that brings about a sense of safety. And then also the idea of predictable routines. I think that's important too. If each module sort of looks the same, like, okay, maybe you have module 1 and then the first little part of it could be like, I know I do this with my class, I got this from somebody else, is that the first part of the module, the first little tab is what you have to do for this module, for this week. You have to read these 2 chapters, you have to read this book, and then write this thing and watch this video. Okay, that's all I have to do, and it's all right there. And if each one is repeated, then it becomes predictable. And then that creates a little bit less of an opportunity for anxiety for the students to think, well, what's this week going to hold? I have no idea. Some people like that kind of adventurous, what are we going to do this week? But I think that it's better to try to keep us calm in the best way we can. Then this trustworthy thing I tried to talk about earlier, the whole concept, but I think we can build trustworthiness by, if we say we're going to meet with students and we're going to say when and where to do that, to show up then. If we say we're going to have the test graded by Thursday, then really do it. You can say you can have it Friday or Monday, but just when you're going to say, follow through with what we do. And I think also to be honest about the difficulty of things. Sometimes I've taught class and said, oh, guys, don't worry, this is not hard content at all. And then you get into it and they're all like, oh my gosh, you're full of garbage because this is really hard. And so I think if I just said, okay, get ready, this is kind of hard and this is tough, but I'm going to explain it to the point, whatever. People before have gotten through it. People before have had a hard time understanding this, but I'm going to be there. So that kind of honesty, I think, is an important element, and also is a trauma-informed response as well. Then I kind of talked about choice already, like, when are you going to do your assignments, all that kind of stuff. How can you do that in a way that's where the person has as much choice as possible? Then I think there's something here also about the choice thing. Is there a way for us to be flexible? Well, here seating is one of them, but like, I know we're talking about an asynchronous setting, but like, encourage people, go where they want to feel comfortable, where they are. And then maybe to think about how they're going to, what sort of format are they going to work with partners? If you want to work with a team or you have a group assignment, maybe the students could choose their own group, but then that can be hard if they don't know anybody. So maybe kind of fostering that. How do you kind of cross that boundary? And then rules, sometimes like family persons that have been brought up with really strict rules, and it's been really difficult for them, and they've not been free to be able to make their own choices. Sometimes when they're coming to college or going to grad school, it's the first time they've been able to make their own choices or their own little rules for themselves. So I think really what we need to focus on is not so much the rule of you better come to class twice, or you have to check the Canvas site 3 times this week, or whatever like that. But to look at it like the objective is, the purpose of doing this is, I want you to engage with the other students, or the purpose of this activity is X, rather than just do it because I said, but what's the point? What's the purpose? What are we trying to do here? It's not a rule for rule's sake, or me trying to control you in some way. Look, this is where we're trying to go with this. I think that can be a really helpful nuance in kind of dealing with some trauma responsive issues or reactions that people might have. I kind of talked already a little bit about collaboration. I think an ongoing assessment with ongoing feedback is another way to look at it, to talk about this collaboration thing too. I talked about like scaffolding some of the like quizzes or assignments or whatever along the way so that people get early successes. But also maybe like if there's a way to kind of like assess early on how things are going for a person, and then kind of check in with people too, depending on the size of the class. Then I think also another big important thing is that how do we foster these stable relationships? Something I think that helps maybe for a faculty member is, for a student, is for them to see the faculty member fully as a human, that they're not just like some hard guy, hard woman that's just whatever going to try to out to get you kind of thing. But look, when I was in graduate school, I dealt with this, or when I was in college, this is what happened to me, or I'm a first generation college student, or I didn't understand this when I was in school. Like, I mean, just even some little insights to yourself, even if you're writing it or saying it or sharing it, however you could do that, or in a video or something, so that people see, okay, this person's a human. I can reach out to them. And I think also just a big deal about celebrating successes. Hey, look, we made it through the first half of the semester, or we made it for the first quarter. That's a really big deal, that kind of thing. And then focusing on strengths, I think I kind of said that right out at the outset, to think, all right, if math may not be your thing, but maybe what's something else that you've been really good at, and how can you recognize your success in that thing that you're good at, and can you apply some of those same concepts to this, like practicing on the soccer field, or whatever it is, things that you're good at that you would want to apply to this same situation. And then we also talked a little bit about empowerment. Is building on strengths and always try to do that, and then to recognize what the person can do for themselves. So bottom line is that I think that so many of our students can discover a sense of resilience in themselves that maybe they didn't know they had. That's the greatest feeling. And I think that's the real bottom line of this trauma responsive care, is if somebody can realize their own resilience. And, we think about resilience as being kind of like, like taking a rubber band, and if you expand it and then you let it go back, it's like, that's resilience, that it can bounce back from stuff. But I kind of think that resilience is even one step further than that. Maybe the rubber band is stretched, and it goes back to where it was, but maybe somehow it's stronger than it was before it got stretched. Or maybe it has more knowledge than before it got tested in some way. So I think there's almost like resilience is almost like a post-experience or post-trauma wisdom, or post-traumatic strength, rather than just, here you're back the way you were. So I think that's a pretty cool thing, and I think acknowledging, now that you've come to college, or now that you're in this learning environment, things are going to be really different. There's going to be some changes. You're going to be challenged, and you're going to, but I think you're going to be stronger for it. I've seen people be stronger for it, in their lives. And here's some things that we can encourage our students to do all through semester. Connect with other students, building relationships with them, remain active, do what you can to get outside. There was this research study that was done. If people in an office environment at least had a window to the outside, and they could see some green trees or green grass or something, their productivity was higher than those that were in places where it wasn't access to that. So just imagine what that could do for our students. Take your computer outside, or go sit by the window, or whatever, and then be able to create some sense of mindfulness. And then I think what's cool too is that maybe you could have somehow set up something where students are teaching other students, that jigsawing thing. Maybe if there's a way that a student could take a concept that no one else in the class has learned and share that with them, that can build, I know I've learned more stuff by teaching it than I ever did as a student. So maybe there's something that could go with that, as far as like an altruism sort of approach to the educational process. And then this is my big push for, of course, all of us to think about our own self-care, like are we watching out for ourselves, and to remember that sometimes a student will come to us and share some difficult things with us, but really we can't take that on. We have to realize that it's up to us to care for ourselves, to do what we can to support the student, refer them to 974 help, refer them to the counseling department, but to remember, I'm doing the best I can. I'm a math teacher. I can't take this home with me. I think that's just something really, really important to remember. And just this self-compassion, and just to have gratitude for what it is that we're able to do. Thank the students. Hey guys, thanks so much for being able to be here. You could even do a thing with, in sort of a discussion post or some sort of responsive thing. Hey, what are you grateful for from this class? What's something positive that you've gained from this class? What's something that you'd like to say thanks to? Those types of things would be really good. So really, and one more thing, I know I put the word here, I took this from something else, but misbehavior. I didn't know what else word to put. Like if a student isn't complying or isn't doing their work, we can't take that personally. We have to recognize that somebody is maybe dealing with their own issue or their own trauma. And then I think also for us to recognize that we can convey calm through our own calmness or our own interest and love for what it is that we're sharing and what we're doing, that somehow that will come through to the students. And I think that's a big deal. Also, just, I know we're at the end, but I just wanted to say this one quick thing, that I think that humility around cultural responsiveness is a big, big deal. If we're able to think about, okay, if it's a special student holiday, I mean, maybe a religious or cultural holiday, how do we acknowledge that in some way? Or maybe if it's something around a meal, or if there's, I don't know, something like that, to just recognize if there's something going on with somebody from their culture. If we're able to do that, I think that'd be a really cool thing to do too. So there's only 3 minutes left, and I probably have 80 more slides, but oh no, that was it. Good. I usually overbook the slides. So, and I've talked too fast and gone on too much probably, but hopefully this was a little bit helpful. Thank you guys for having me. Bye.
Great. Thanks, Dr. Schriver. Have a great day.